Well, good afternoon, everyone. I hope everyone's safe and cool. I know it's really been hot out there, but thank you so much for joining us and being here with the Georgia Budget and Policy Institute. Today is the first day of the new fiscal year, and we are excited to bring you our version of our primer related to the budget. I'm so glad you've joined us. And we have officially, as you can see on this QR code, launched this year's Georgia Budget and Policy Institute's Budget Primer to begin really an important conversation about Georgia's future. You know, at GBPI, we often say that budgets are about more than dollars and cents. They're one of the clearest expressions of what we really value. Every budget tells a story about who matters, what problems we're willing to solve, and what kind of future we're building. And this year's primer arrives at a really pivotal moment. Georgia's preparing to elect a new governor for the first time in 8 years and new leadership for many positions that influence the budget. That means we're closing one chapter in our state's fiscal history while beginning to imagine what the next one might look like. Governor Brian Kemp's administration leaves behind a complicated legacy. Under his leadership, Georgia maintained a AAA bond rating, navigated the economic uncertainty of the pandemic, invested billions in infrastructure, expanded the Hope Scholarship, created our state's first need-based aid program, and helped build an economy that continues to attract businesses and jobs. Those are real accomplishments that deserve recognition. But a balanced budget and a growing economy don't automatically mean every Georgian is thriving. Throughout this period of historic revenue growth, Georgia consistently collected more than it spent. The question wasn't whether we had the resources to invest more deeply in our people. The question was how we choose to use those resources. Too often, those choices favored tax cuts for the wealthy over lasting investments that would impact all Georgians. Even years after our economic growth began, Georgia continues to have one of the highest uninsured rates in the country. Childcare remains unaffordable for many of our families. Rural hospitals continue to struggle and even close. Public schools face growing transportation and health insurance costs, and far too many communities still lack the opportunities they need to succeed. We are investing less in FY27 in the people than when this governor took office. And those challenges didn't emerge because Georgia lacked resources. They reflect choices. And as we look ahead, those choices become even more important. The next governor won't simply inherit a strong economy. They'll also inherit new financial pressures, unlike anything Georgia has ever faced before. Federal policy changes from HR 1 are shifting significant costs onto our state. Georgia has already had to replace tens of millions of dollars in lost federal SNAP administrative funding, and future costs could grow dramatically. At the very moment these new obligations arrived, recent state tax cuts have permanently reduced the revenue available to meet them. That makes the decisions of this next administration and the next General Assembly even more consequential. One of the things I appreciate most about this year's primer is that it doesn't simply look backward. It provides a context of where we need to go. How will we move forward? It highlights meaningful progress while also identifying missed opportunities. It asks us not just whether Georgia's finances are strong, but whether they're serving the people's needs. And it reminds us that every budget is ultimately a reflection of our priorities. This year also reminds us why persistence matters. For 15 years, Georgia Budget and Policy Institute advocated for need-based aid in Georgia year after year. We made the case that talented students shouldn't have to abandon their education because of financial barriers. This year, that vision finally became reality. That victory reminds us all that meaningful change doesn't often happen quickly. And it certainly doesn't happen quickly here in the South, but it does happen when research, advocacy, data, science, partnerships, and community voices come together around a shared goal. And that is exactly, y'all, why GBPI exists. We believe in good policy with good information. We believe budgets should be transparent and accountable. And we believe every Georgian deserves the opportunity to thrive regardless of where they live, what they earn, or what challenges they face. As we begin today's conversation, I encourage all of us to think beyond the numbers. Think about the students now who can attend college because of need-based aid. Think about our families out there trying to afford health care or childcare. Think about rural communities fighting to keep their hospitals open so they can access health care when they need it. Think about the children who deserve access to nutritious food, quality schools, and safe communities. Those are the lives behind every line item in the budget. I hope that our primer at GBPI gives policymakers, advocates, journalists, and community members the facts they need to better ask questions, make better decisions, and imagine a Georgia that fully invests in its people. And thank you all for being a part of this conversation. It's great to see so many people online today caring about Georgia's future and for the work each of you do to help build a state where opportunity really reaches every community. You can find our primer online now. You can go to this QR code or go to gbpi.org/primer. And I wouldn't be doing my job as CEO if I didn't tell you that this work happens because people invest in it, people like you. We are not a government-funded entity. We are an independent 501(c)(3). So please consider using this QR code or go to gbpi.org/donate to make a gift to the Georgia Budget and Policy Institute. It is tax deductible. So now let's dive into this year's Georgia Budget and Policy Institute's primer. I'm going to hand it over to my colleague, Vice President of Public Policy, Dr. Danny Canso.
Great. Well, thank you so much, Stacy. Good afternoon. It is wonderful to be with y'all. Today is the first day of the 2027 fiscal year that will continue over the next 365 days until June 30th. And this year in the budget primer, as Stacy mentioned, we took an 8-year look back. So periodically, you'll hear us pause and make comparisons to FY 2020. And how things have changed over the last 8 years in Governor Kemp's tenure. And remember, FY 2020 started July 1st of 2019. So that gives us a look at the last 8 years where the population of the state of Georgia has grown by about 820,000 people. But at the same time, as Stacy noted, because inflation has been persistently high, it's been about 31% over those last 8 years. The state is actually spending less per person, about $23 less than we did in FY 2020. So if we continue to the next slide, we'll just start off with the basics of Georgia's budget system. $76.7 billion will be spent over the next year. You can see the majority of that comes from state funds, largely state general funds that can be used flexibly. About 32% of that is coming from federal funds. About 8% of that going to the state health benefit plan and other transfers between government, about 6% designated funds. And then if we go to the next slide, we'll zoom in a little bit on where Georgia gets the revenue that we do spend over the year. So when we talk about the state budget, we're really talking about the $38.5 billion that the state raises and spends itself. Of course, that's matched by additional federal funds, primarily for healthcare, but also for education and other services that we'll also talk about. But you can see that the income tax really does power state spending, raises about 50 cents of every dollar the state spends, cumulatively about $19.2 billion. The vast majority of that comes from the personal income tax that households pay, about $16.1 billion, and about $3.1 billion coming from the corporate income tax. In Georgia, we have the same rate for both of those. We'll talk about that a little bit further. That's been an area that has changed this year, retroactively, actually. So the flat rate for corporate and individual income is taxed at 4.99%. We also have a 4% state sales tax that raises about $9.8 billion, about $3.1 billion raised. You can see through a variety of other taxes and fees, from vehicles to alcohol and tobacco, about $2.1 billion raised from regulatory fees and interest that the state collects on accounts like its surplus. And then about $4.4 billion in designated funds, trusts, and other special accounts for specific purposes. The largest share here is motor fuel. Those funds have to go towards infrastructure in instances like we saw the last couple of months where the gas tax was suspended. The state backfills that with surplus dollars so that it can meet kind of the obligation of what it expects to raise through gas taxes. The next largest designated fund is lottery. Those dollars have to be used either for higher education scholarships or pre-K. And so, go to the next slide. You can see that about 75% of every dollar the state spends out of that $38.5 billion budget for the next fiscal year goes to education and healthcare. Pre-K through 12th grade education is the largest area of state spending, about 39%, followed by higher education, about 15.2%. When we combine those areas, we get about 54% of state spending. The vast majority goes to education alone, about 21% for healthcare. And then you can see these other areas comprise a relatively smaller share. So transportation is next. Again, that's primarily gas taxes. Criminal legal system, about 6.5%. Government services that are shared by about 30 state agencies, just about 3% of state spending. Debt service, that's an area we've seen gone significantly down during Governor Kemp's 8 years, where paying for infrastructure in cash has been a big priority. We've actually seen per capita debt service costs go down by about 35%. So that's an area of the state budget that has shrunk significantly over the past 8 years, about 3% for human services, and then about 2.3% for courts and public safety. So if we go to the next slide, you can see how that's matched by about $24.7 billion in federal funds. So the vast majority of those federal funds are enrollment-based for federal programs. Medicaid makes up the lion's share of that. About 59% is healthcare and public health together, about 12% for pre-K through 12th grade education. When we look at education spending as a whole, as my colleague Ashley Young will cover, you can see that local school districts raise the plurality of education funds, followed by the state government, followed by the federal government contributing just a small share. About 10% of federal funds go towards higher education, and then you can see the remaining distribution, where I'll just say that human services is a considerable area as well, where we're getting a larger share of federal funds currently for human services than state funds. So we continue on to look at some of the budget trends that we've seen both this year and over the last 8 years. And I think it's important to start with really the unprecedented line item vetoes and budget disregards that we saw from the governor. And as I'll talk about in the next couple of slides, the reason that the governor gave for these really unprecedented budget cuts were that the General Assembly passed a larger than expected income tax cut. As I'll walk through, there are going to be more benefits in the first year, and if that legislation were to be fully implemented, that would go to the top 1% and corporations, then to the first 3 million households, or the first 60% of Georgians combined. So really dramatically skewed towards corporations and top earners. And as a result of that, the governor chose to make about $344 million in unilateral cuts after the General Assembly had sent the budget to his desk. So those were made through a combination of line item vetoes, which are the more traditional way that people think of executive budget cuts, where the governor strikes an area and then that is part of state law, versus a budget disregard, which is considered non-binding. And that is part of the expansive authority that the governor has in Georgia over setting the revenue estimate, when essentially the governor can say at any time that there has been a projected change in the revenue estimate, and as a result of that, a certain amount of funding is withheld from state agencies that is still technically part of state law. So that's what we saw for close to $329 million of these unilateral cuts. In effect, they're basically the same. The agencies don't get the money and they can't spend it. And so that is going to mean cuts for everything from $100 million that would have gone to retired state employees who've gotten very little in cost of living increases in recent years since the Great Recession, to about $82 million in health cuts, over $80 million in education cuts, and cuts to areas that will hurt the most vulnerable Georgians, from victims of sexual assault and domestic violence to our students and school systems that are struggling to raise enough money for student transportation. And you can also see that this is so stark because when we look back at the last 8 years of the governor's tenure, cumulatively, there have only been about $703 million in executive budget cuts. So this year alone, we saw almost as much as the previous 7 years combined. And if we go to the next slide, you can see what this went to pay for. So this, before we get to the most recent income tax cut, I'll just share briefly. When we look from 2017 to 2025 at the state and the federal level, we saw $21 billion of annual state and federal tax cuts in Georgia. So when we look at the distribution of that $21 billion per year, about 74% of that goes to those in the top 20% who are earning more than $150,000 a year. So what this chart shows you is that distribution. The gold line shows the percentage of those tax cuts across these income groups, where each group of 20% has about 1 million households, and the blue bars show the average tax cut. So those in the top 1% are getting cumulatively 25% of that $21 billion, far and away the greatest share, and also the greatest average tax cut, almost $105,000 per year. The 1 million households at the bottom, they're actually averaging a tax increase because they've lost substantial benefits, primarily through healthcare tax credits that were making the cost of healthcare more affordable. And so they're paying more, getting virtually nothing of what's been enacted. And as a result of those $21 billion, our tax code has become, both at the national level and at the state level, significantly more aggressive. So on the next slide, this year, the General Assembly passed and the governor signed House Bill 463. So that is a 9-year income tax plan. In its first year, it costs about $1.2 billion. If we were to fully implement it over the next 8 years, it would cost about $6.3 billion in total. And the effect is really doubling down on that same regressive tax policy that we've tried since 2017, that many Georgians really haven't felt and haven't noticed. So if this legislation were fully implemented, those in the top 1% would see an average of almost $20,000 a year in tax cuts. The 1 million households in the bottom 20% would see less than $10 a month on average. Middle income households in Georgia would see about $600. Again, that would be 8 years down the road if we were to fully implement this very costly tax package that we don't have a plan to pay for. So we can continue on and look at the revenue shortfall reserve for Georgia. So this is an area where we've again seen very significant change over the last year. The state went into the legislative session with about $15 billion in cash on hand. We spent down about $6.2 billion of that. And at the same time, HB 463 made some changes to the threshold. So previously, there was a cap on the regular savings account, the revenue shortfall reserve, at 15% of revenues. That was raised to 20%. So now that account's going to grow from about $5.6 billion to closer to $7.5 billion. And as a result, the undesignated reserves, the gold line that you see on this chart, the gold bar, is going to decrease to between $1 and $2 billion. Significantly lower than the $9 billion plus in undesignated reserves that we went into the legislative session with. And again, that's in part of that statutory change, and also in part because we've spent those reserves. We spent reserves on $2 billion in one-time tax rebates, about $325 million for the Dreams Need-Based Scholarship, other funding that went to infrastructure to create a new psychiatric hospital in Georgia for $400 million. So multiple big ticket line items that use those reserves. So on the next slide, this just briefly summarizes what I just talked about, but certainly folks can look to the primer for more of that detail, where you can see the most significant spend down in Georgia history of reserves over the last year in the amended fiscal year that ended yesterday. So on the next slide, we go through the $33 billion in tax expenditures that the state will offer in FY 2027 and show that the majority of those are sales tax expenditures. So of $33 billion or so, about $16 billion are sales tax expenditures for basic services as well as specific items. On top of that, there are about $2.7 billion in corporate tax breaks and about $5.9 billion in personal income tax breaks, everything from the standard deduction to itemized deductions. And so now, very briefly, I will lead off our early childhood education section in the next slide, and then hand it over to my colleague, Ashley Young. But as we look at the decal budget for 2027, $672 million in general funds and lottery funds will be spent. And of that, the lion's share, about $594 million, goes to pre-K, as compared to about $78 million that goes to childcare. This is an area where we've seen a lot of attention dedicated in Governor Kemp's tenure to enhancing funding for pre-K, relatively little to childcare aside from doing the minimum. And we've also seen as enhanced federal funding expired that allowed us to significantly grow that program in the wake of the pandemic, we've seen Georgia lower its eligibility threshold for income to the lowest level in the nation. So childcare is an area that really has gone unaddressed and remains an urgent need. So if you look on the next slide, you can see just the trajectory for pre-K, where this year we're adding about $31 million. And if we look at the last 8 years, we've seen growth of about 57%. So in comparison, inflation has been about 31%. So growth that considerably exceeds the rate of inflation there. When we compare that trend to childcare, we've seen a rate of growth of 25%. So about 6% below the rate of inflation alone for funding for the CAPS program. This year, because of actually some of those investments in pre-K, the state was able to redirect about $10 million in federal funding that will increase the number of slots by about 1,300 that are projected, but still just scratching the surface of need and continuing to maintain some of the narrowest eligibility thresholds in the country. So with that, I will turn it over to my colleague, Ashley Young, to continue to walk through the education policies in the FY 2027 budget.
Thank you, Danny. Hello again. My name is Ashley Young, Senior Education Policy Analyst, and I focus on K-12 and higher education. For education this session, it was filled with fiery debates on property tax elimination and public school funding, along with a major victory that Stacy shared a little bit earlier, as the first need-based aid scholarship in Georgia was established in over 30 years. Yay, that is super exciting. Needless to say, it was a historical session. So let's get into the details beginning with K-12. The Department of Education, DOE, the governing agency that manages the oversight of public school funding in Georgia, actually serves over 1.7 million students in the state of Georgia. In the FY 2027 budget, the Department of Education received about $14.2 billion in state funds. That's 39% of the state's total budget. And this year's budget was about $480 million more than the FY 26 budget, equaling about a 4% 4% increase. As Danny mentioned, this year we are keenly focused on an 8-year look back of the K-12 funding and policy changes during the Kemp administration. I first want to point out that over the past 8 years, DOE has increased by $3.5 billion. That's a total of 33% or 365 million and about 3% when adjusted for inflation. Although we see a slight increase in the budget during the first 8-year period, enrollment has actually dipped slightly from 1.72 million to 1.71 million across the state of Georgia. As for the FY 2027 budgets, which you see here, we saw a $69.8 million added for increased state health benefit plans, which I'll talk a little bit more about in just a moment. And the per member per month rate increased from 1885 to 1935 a month. This will also require school districts to contribute about $40.3 million in local funds. 70.4 million added to establish the implementation of literacy coaches. You probably have heard in the news about wanting to address literacy. And so 70.4 million has been added so that every elementary school, as a part of the QBE formula, will have a literacy coach. 41 million to cut private school vouchers through the Georgia Promise Scholarship. This is due to the lack of demand for the eligible students in 2025. Of course, this program is brand new. This was the very first year. This is the state's latest voucher program, education savings account for eligible students that can receive up to $6,500. 2.9 million was added for student support services, and this includes 1.6 million for social work grants and 1.3 million more for mental health support grants. And lastly, you'll see that the 15.3 million to cut, or rather eliminate the pilot program, which could have served to help as an opportunity weight for students living in poverty. Unfortunately, that was cut. You may be aware that this was lawmakers, they voted last year for this $15 million in funds for students who are financially marginalized. Next slide, please. This year, like most state agencies, education agencies, the Department of Early Care and Learning, the Department of Education, Technical College System, University System of Georgia, Georgia Student Finance Commission, experienced a record number of budget disregards. These budget changes will impact students across the K-12 spectrum through post-secondary education. I want to just name a couple of our notable highlights here. $30.7 million for additional school transportation for school bus operations. And another important one is about $12 million in bonds for financing $50 million in school safety grants. Now, as you can see, the Department of Education had the most disregards in line item vetoes, totaling about $58 million. That's about 17% of the DOE's FY 2027 budget. This is why it's so record-breaking. The University System of Georgia was second with about 5%, second under the education umbrella, with about 5% of its budget, which was about $18.7 million disregarded. And then other agencies, or the remaining agencies that you see here, the Department of Early Care and Learning, Georgia Student Finance Commission, and Technical College System were not affected nearly as much, with less than 2% of their FY 2027 budget disregarded. Next slide, please. As I mentioned earlier, the debate around property tax elimination was a major topic in this legislative session. Many lawmakers in the majority caucus sought to address the issue of affordability. But with these measures, unfortunately, came a lot of severely cuts or eliminating property taxes altogether. At GBPI, though, we understand the significance of protecting property taxes as the primary source of revenue for local governments, providing 2/3 of tax collections for cities and counties and schools in Georgia. School districts, in particular, are most reliant on property taxes, which generate about 71% of tax revenues in 2025. So, as you see in 2020 from this graphic here, the state covered around 47% of the costs for public schools on average, but by 2025, that had decreased to 43% of total costs, with the federal government covering around 8 to 16%. Remaining costs are left for local school districts. That has been a major theme, unfortunately, in this past legislative session that we have been raising the alarm around. And just the last decade, the state share of K-12 education funding has decreased by 20 percentage points, while local school districts have seen a similar increase. Next slide, please. To better understand the context of property tax changes, it's important to note that in 2024, voters approved a constitutional amendment which created a floating statewide homestead exemption. And this essentially just prevents taxable home values on property residences from increasing above the rate of inflation from year to year. Local governments were given the option to opt out, and 68% of school districts actually decided not to enact this measure. However, during this last legislative session, the General Assembly passed SB 33 to actually remove this opt-out option for local governments, mandating the floating homestead exemption to cap property taxes increases at the rate of inflation. While this measure isn't nearly as bad as eliminating property taxes, because it got a little scary during session, to be very honest, the drawback with this current policy is that it decreases property tax revenues. It reduces school districts' autonomy to regulate their own budget alongside existing tax exemptions. And moreover, like we've seen in other states, school leaders have struggled with larger class sizes, higher student to student ratios that ultimately can negatively impact institutional quality and student success. Next slide, please. This is exacerbated when we look at other ways in which lawmakers have disinvested in public K-12 education. We've actually identified here at GBPI 3 critical ways through transportation, equalization grants, and the state health benefit plan. And I just want to kind of highlight only one of them for the sake of time, the looming financial crisis that this policy has created. So as you can see here, the state health benefit rates, have spiked, and this has actually shifted the cost directly to local school districts. As you can see in 2010, that per member per month rate was about $163. It has now skyrocketed to $19.35. There was also a big spike from 2023 to 24. There have been instances, we've talked to CFOs where actually for some of their staff, their non-certified staff, think cafeteria workers, bus drivers, where the money that they are shelling out for their state health benefit plan is actually more than the salary of the actual employee. So this is again a looming crisis that has been shifted to the local school district. Next slide, please. Now moving forward to post-secondary education, beginning with the University System of Georgia. Again, this is our four-year public higher education system. The total budget in FY 2027 is $3.9 billion, and this is about $256 million or 7% more than last year's budget. Just to name a few highlights, $218 million was added as to reflect a 5% enrollment increase and corresponding square footage for instruction or instructor increases. You may have seen this in the headlines. There was about a $34 million cut for USG for online courses and instructor salaries. And then about $9.5 million added to support the expansion of the new graduate medical school established at University at the University of Georgia. Next slide, please. I'll quickly just highlight here how even though we are seeing some increases in our budget over the years, we're also still seeing that it is not keeping up with the 75% commitment. As we know, everything is getting more expensive, and that includes post-secondary education. So as you can see, the state has committed to a 75% of the student share in the funding formula. However, we only see a commitment this year of about 58%, and that means that the student's cost share, which should be 25%, right, is now up to 42%. Again, I've said this, if this isn't your first time here with the GBPI group, you've probably heard me say that we are third in the nation for student loan debt. And so this is where the rubber meets the road. This is where we're seeing, even though our tuition rates have been kept low, we are still seeing challenges for students, especially especially those who are financially marginalized, pay for college. And when we are not meeting that 75%, this is where we are seeing these discrepancies and the disproportionate challenges for students who are unable to pay for college. Next slide, please. Georgia's two-year post-secondary system, as we know, is the Technical College System of Georgia. And the total TCS budget for FY 2027 was 564 million. And that's about 25.8 million, 5% or so more than last year's budget. As you can see, the two top highlights we have here are $11.4 million in bonds added to the finance, the 78.4 million in capital projects at various TCSG institutions, and then 34.1 million added to reflect a 9.4 increase in enrollment. So that is a very exciting thing happening at TCSGs. They've had a great increase in enrollment. I'll talk a little bit more about that on this next slide, please. Now, this graphic looks back over about 8 years, and it shows how TCSG enrollment has fluctuated, especially during the COVID pandemic. However, enrollment has steadily recovered since the pandemic. In 2025, enrollment in TCSG increased by about 9%. Unfortunately, enrollment data for 2026 and 27 are not available. However, the good news is between 2020 and 2025, funding per student has also increased significantly from $5,494 to $7,216. Next slide, please. Now, for the Georgia Student Finance Commission, of course, we know this is our state's higher education finance agency offering over 20 state and lottery funded scholarships, grants, and loans. A few budget highlights here that I will share with you all. About 44 million added for Hope Scholarship to meet the projected need for enrollment at public colleges, 21.3 million for dual enrollment to meet projected enrollment, about 4 million for tuition equalization grants. Of course, we use these for Georgia residents who attend private post-secondary institutions, and about 2.5 million to establish the Georgia Foster Care Scholarship, which is a major win, and about $1 million to continue to expand the College Completion Grants Program, which is our emergency funding for students who are almost at the finish line but need additional funding. Next slide, please. Can we just have a moment of silence, or actually a moment of glee, of happiness? How about this? We have a newly established need-based aid program, the Dream Scholarship. This is a watershed moment. I have loved saying the word watershed in the media and with our partners because that is exactly what this is. My time is winding down, but I am just super excited for this major policy win. And there's been about $325 million appropriated, so about 300 for the endowment and 25 million for scholarships for the Dream Scholarship. Again, need-based aid scholarship will help students who are financially marginalized and have unmet need. And what is very unique about this scholarship and what we have advocated for at GBPI is that the annual allocation is based on the percentage of federal grant Pell Grant recipients. So institutions will receive their amount based on how many Pell Grant students are enrolled at the institution. That's a major win in this policy. Right now, only USG and TCSG institutions will receive, students will receive the Dream Scholarship. We really hope to get our private independent colleges on board very soon. Institutions may require students to complete an institutional application. I'll talk a little bit more about that in our Q&A, but just wanted to note that here. Next slide, please. Wanted to give you just a few more details. Students can receive up to $3,000 per year based on unmet need. Maximum semester award is about $1,500 for up to 8 semesters, and recipients must complete a minimum of 60 hours of paid or unpaid work for each term disbursement. This is also at the center of the debate. Certainly, this is unprecedented, and we were really advocating for no work requirement We are hopeful that we can continue to shape this policy in a way that will not require students who are eligible for need-based aid to have to work. However, students can engage in military service, internship, co-op to count towards the need-based aid scholarship. Okay, next slide, please. Lastly, the education lottery during Governor Kemp's administration over the last few years, the lottery has consistently raised more revenue than projected. I want to point out that at the end of FY 2025, the total education lottery reserves was about $2.5 billion. The minimum balance, which is also referred to as our restricted reserves, amounted to about 796 million. The total unrestricted lottery education reserves are at a record 1.7 billion, which of course can be used to fund pre-K or post-secondary scholarships. One important change that I will note is the revision of the shortfall lottery reserve. In SB 556, which is the Dream Scholarship Bill, lawmakers voted that the shortfall restricted reserve will now maintain at least 50% of the preceding 3 years lottery proceeds or expenditures, whichever's higher. This is a new change, whereas before it was only 3 years of the average net proceeds prior. These 3-year averages from 23 to 25 for lottery remains approximately around $45 million higher than the average for lottery expenditures. As you can see, there are a lot of significant changes in K-12 and post-secondary education in the 2026 session. I am looking forward to the off session where I believe we will have critical elections that will shape education, a new chancellor of USG, and study committee results and more. Stay tuned. But this concludes my portion. I will now turn it over to Leah Chan, who's Director of Health Justice Policy. Thank you.
Hi, good afternoon. Next slide. So I'm very excited to chat with you all today about the budgets for our state's 3 primary health agencies focused on healthcare and public health. So those include the Department of Behavioral Health and Developmental Disabilities, which operates state psychiatric hospitals and provides community-based services to Georgians living with mental health conditions, substance use disorders, and developmental disabilities. The Department of Community Health, which administers our state's Medicaid and Peach Care programs that provide coverage to folks with lower incomes, and the Department of Public Health, which operates programs focused on disease and injury prevention, health promotion, and health-related disaster response and preparedness. So under Governor Kemp's administration, total state-funded appropriations dedicated to the state's 3 primary health agencies have grown from a combined total of almost $5 billion in fiscal year 2020 to about $7.8 billion in fiscal year 2027, excluding their administratively attached agencies. So as you can see, state funding for all 3 health agencies has grown over time, and it has exceeded the rate of inflation. However, the proportion allocated to each agency has remained mostly the same. So about 7 in every 10 state dollars spent on Georgia's 3 primary health agencies has consistently been provided to Department of Community Health over the past 8 years. Next slide. So again, DCH, and specifically our Medicaid program, accounts for the majority of the total state health spending increase over the past 8 budget cycles. So from 2020 to 2027, total state funds allocated to Medicaid and Peach Care grew from about $3.4 billion to about $5.5 billion. So overall, Medicaid is a cost-effective program, and costs typically grow at a slower rate than both Medicare and private insurance. And much of the substantial growth in state Medicaid spending over the past 8 years is really reflective of external factors being experienced across states rather than significant new investments unique to Georgia. So for example, all states are dealing with the rising cost of prescription drugs that are covered under Medicaid, dealing with an aging population with more acute needs, and with federal healthcare policy changes like Medicaid continuous enrollment during the pandemic, Medicaid unwinding, and now HR 1. Next slide. So during Governor Kemp's administration, state elected officials have supported some really critical state investments across all 3 state health agencies. So zooming in just on fiscal year 2023 alone, state funding increases resulted in the launch of Georgia's home visiting program for pregnant people and their infants, the extension of postpartum Medicaid coverage from 6 months to a year, and $5,000 cost of living increases for state agency staff, along with salary increases for hard to fill health agency staff positions like psychiatric hospital nurses and environmental health specialists. But even with these important state health budget increases, Georgia continues to rank near the bottom nationally when it comes to clinical care measures related to access and quality and uptake of preventive services. So just as one example, in 2025, 16.4% of adults Georgia avoided care due to costs compared to about 11.5% nationally. So all of that to say, this substantial increase in state health spending over the past 8 budget cycles really reflects responses to changes in the healthcare system more broadly, along with some smaller but very critical state level investments. But ultimately, this increased spending over the past 8 years has really not moved the needle on access to high quality, affordable healthcare for Georgians in need. Next slide. So in order to partially offset the cost of the more than $1.2 billion in income tax cuts approved through House Bill 463, the governor is directing state health agencies to disregard about $81.8 million in total state health funds. The disregards, they represent a small proportion of each department's total funds, but do leave us with growing health challenges to linger until the next budget cycle. So just as an example, the governor is directing the state agencies to disregard $48.4 million that would have supported reimbursement rate increases for Medicaid providers, $9.6 million that would have opened up 400 new home and community-based waiver slots, as well as support for program administration of the NowComp waiver program, and $4 million that would have helped us develop and implement a rural hospital solvency evaluation plan. So next slide. So again, the Department of Community Health administers the state healthcare safety net, reimburses hospitals for services provided to uninsured and underinsured Georgians, manages the health insurance coverage for state and school system employees that Ashley talked about, and regulates health and long-term care facilities. So the 27 budget provides the department with $5.8 billion in state funds, including the attached agencies. And as usual, about 93% of total state funds are earmarked for Medicaid and Peach Care. Next slide. So again, Medicaid and Peach Care provide affordable health insurance to about 1.8 million Georgians with lower incomes. It allows them to see the doctor, fill prescriptions, and get access to preventive care. Peach Care covers a small subset of children from families with incomes above the Medicaid threshold. Low-income Medicaid covers children, pregnant and postpartum people, parents with very low incomes, and adults who qualify under the Pathways to Coverage program. And the Age Blind and Disabled program covers older adults and individuals with disabilities, and as you can see, accounts for about 58% of total FY27 state funds for Medicaid and Peach Care. And before we move on from this slide, I do want to note between July of 2024 and December of 2025, child enrollment in Medicaid and Peach Care in Georgia declined by 10%. And that downward trend is forecasted in this budget to continue, as we can see by the 2027 reduction in base funding that accounts for projected enrollment decreases in low-income Medicaid, which a majority of those enrollees are children, and decreases in Peach Care enrollment. So the explanations behind these really concerning child enrollment declines are not yet fully understood. Next slide. So access to affordable, high-quality healthcare really does continue to be a struggle for many Georgians. We have the second highest uninsured rate in the nation, and among children, uninsured rates have increased, as we just discussed, and remain above the national average. So the implementation of a new federal law is really going to worsen Georgians' existing healthcare access and affordability issues. So on July 4th of last year, the president signed H.R. 1, formerly known as the One Big Beautiful Bill, into law. So in order to fund tax cuts for the wealthy and corporations, this law really significantly reduces federal spending on healthcare coverage and food assistance for lower income Americans. So over the next decade, HR 1 and some related federal funding and policy changes will really drastically alter which Georgians are eligible for or can afford Medicaid and Georgia Access coverage. And these changes will also alter how the state is able to adequately compensate healthcare providers serving Medicaid patients. So without federal or state action, these policy changes will mean more uninsured Georgians, more rural and safety net hospitals at risk of service reductions or closures, and more demands on Georgia's state healthcare budget. So we've already seen more than 500,000 Georgians drop their marketplace coverage due to the failure of this law to include an extension of the tax credits that make those plans affordable. And we'll see more changes unfolding over the next several years. And for the sake of time, I won't go into detail, but it is important to note that these changes have significant state budget implications, and there are actions that we can and really must take at the state level to mitigate the harm. Next slide. So the Department of Behavioral Health and Developmental Disabilities provides services primarily for uninsured and underinsured Georgians living with mental health conditions, substance use disorders, and developmental disabilities. It also operates our state psychiatric hospitals and provides community-based services through contracted providers. And it operates forensic evaluation and treatment programs for individuals under the court system's jurisdiction. So the fiscal year 2027 budget provides the department with $1.7 billion in state funds. And that represents a decrease of about 11 million, or almost 1%, below the original fiscal 2026 budget. Much of that decrease is accounted for by the reduction in the employer contribution rate for the state health benefit plan, but it doesn't impact core services for Georgians. Next slide. So after a lawsuit found that individuals with mental illness and developmental disabilities were being unlawfully segregated from society and held in the state's psychiatric hospitals, Georgia entered into a settlement agreement with the federal government in 2010. So the Department of Behavioral Health and Developmental Disabilities fiscal year 2027 budget includes some increases that are aligned with the settlement agreement goals around expanding access to community-based services. So that includes about 9.3 million in state funds for 404 additional vouchers for the Georgia Housing Voucher Program. And that provides housing and supports for Georgians with serious mental illness who are currently or at risk of becoming unhoused. And about 2.3 million in state funds for 100 new now comp waiver slots, which provides home and community-based services for Georgians with intellectual and developmental disabilities. And in February of 2026, a federal ruling released Georgia from the behavioral health provisions of the 2010 settlement agreement, due in part to the increase in housing voucher slots. And the state might pursue action in the near future to exit the intellectual and developmental disabilities provisions. But it is important to note that even with these increases, access to community-based services really falls short of Georgians' needs and prevents the states from reaping the economic benefits. So, for example, transitioning from reliance on nursing homes and institutional settings to home and community-based care really results in long-term state cost savings and improves health outcomes. But what we see is that the 100 new slots combined with the 400 slots opening to attrition is just 6% of the almost 8,000 person planning list. And similarly, supportive housing really does produce state cost savings by relieving the pressure off hospitals and jails and improving child welfare outcomes, and really allows struggling Georgians to break the cycle of homelessness. But those 404 additional voucher slots, while fantastic, are a mere fraction of the 9,000 supportive housing vouchers that were required by the original settlement agreement language. Next slide. So lastly, Department of Public Health operates programs focused on disease and injury prevention, health promotion, and health-related disaster response and preparedness. The 2027 budget provides the department with about 429 million in state funds. And this represents a decrease of about 6 million, or 1.5%, below the original fiscal year 26 budget. Again, much of that decrease is accounted for by the reduction in the employer contribution rate for the state health benefit plan and does not impact core services and functions for Georgians. And one really notable 27 budget increase for DPH is an almost $4 million increase to expand the home visiting program to 33 more counties, which will allow the program to serve families in a total of 103 rural counties. So with that, I will pass it now to my colleague, Danny Canso.
Great, thank you, Leah. And so now in our economic justice portion, we'll talk primarily about the Department of Human Services, which has had an enormously challenging year, partly because, as Leah laid out, under HR 1, the federal government has initiated the deepest cuts to SNAP that we've ever seen in program history. And last year, through SNAP or food stamps, about $3.5 billion came into Georgia to help more than 700,000 families, or about 1.4 million Georgians put food on the table. So an essential program where we're seeing the deepest ever federal cuts. And now this year, the state will have to start paying a larger share of administrative costs as the federal government tapers off. And if those provisions of HR 1 remain, the state will have to begin paying a share of program costs, very likely, which we'll cover a bit further. And then on top of that, Georgia's Department of Human Services began the budget cycle in a child welfare crisis and facing an $86 million deficit for the Division of Family and Children's Services due to the rising costs of caring for children in the foster system. So this is a relatively small agency as far as state dollars go, about $1.2 billion, about 3% of the overall $38.5 billion state budget, but a critically important agency that is facing really unprecedented challenges on a multitude of fronts. So you can see this is just the layout of the state portion of the DHS budget, foster care, adoptions, and child welfare services being by far the majority of where those funds go, with also a substantial share going to elderly care services, other child support services, and attached agencies. And then on the next slide, you can see that this is an agency where the governor's budget disregards, although it was $15.8 million, almost $16 million, $315, disregards cut resources at a time where every dollar really counts. So $2 million was withdrawn that would have gone to cover Georgia's participation in the Sunbuck Summer Nutrition Program. That was really a down payment on about a $5 million cost, but it would have allowed the state to draw down more than $140 million in federal resources. There were also cuts to other child welfare services, again, as we're facing a really unprecedented crisis there. So next slide. You can see that of about $2.6 billion in total funding, about $1.4 billion of that comes from the federal government. So about $1.2 billion in state funds, and then about $560 million from other sources of federal funds, about $405 million in TANF funds, and then you can see about $217 million from Medicaid, about $96 million from foster care, about $75 million in federal energy program dollars moving through the agency, and then a few smaller grants as well. And so those federal functions drive much of what DHS does, but enhanced state funding is also very critically needed, particularly when it comes to the SNAP program and continuing to stem the loss of and high turnover rates for eligibility workers. So in recent years, the state has slightly raised those salaries. That has led to increased retention and an improvement. But as I mentioned, because the federal government is now shifting a share of program costs onto the state, based on what is called the error rate for the SNAP program, it's going to be essential to invest even more on the administrative side. And so basically the error rate is caused by both errors by the state and errors by clients and users of SNAP. that in a lot of cases can just be documentation issues, files not matching, and a result of a really burdensome and difficult to use verification process. And so, unfortunately, we don't have enough caseworkers to process the need, and have a very high volume of cases that folks are having to deal with a relatively high turnover rate that remains for the agency. And so, as a result of that, as we saw earlier this month, the state has an error rate of over 15%, which is one of the highest in the nation. If the state continues to maintain an error rate over 10%, we'll have to pay the equivalent of about 15% of program costs, which could be up to $500 million a year. If we're able to lower the error rate below 6%, there wouldn't be a cost sharing element. And the lowest here would be about 5%, equivalent to about $200 million a year. So unless federal law is changed, which is something that Congress could consider as part of the upcoming renewal of the Farm Bill, and certainly the Senate Agriculture Committee has debated and is debating amendments to that effect. But if that policy remains, then very likely Georgia by 2030 would have to begin paying a share of the costs for the SNAP program, and if things stand as they are now, would be paying into the highest tier of that, which could be the equivalent to adding about 50% to the current state budget for DHS. So a really substantial hole in the state budget for an essential program that brings in much more than that to the state. Again, about $3.5 billion last year alone from SNAP or food stamp benefits. So next slide. And now I'll turn it back to Erin Robinson, GBPI's Vice President of Outreach.
Thanks, Danny. So if all our analysts wanted to come here, we are going to jump into the Q&A section in just a moment. I did want to make a quick announcement first. So I know the QR code might not be working for some folks, but if you go to that link, you will see the individual documents for each of the primer sections. I know a lot of you are used to the digital booklet. That will be uploaded later. So we'll make sure that everyone who's registered for an event will get that link when the digital booklet is live. And we'll also, it's not too late to hop on our mailing list for a physical primer. I know it's 2026, but some people like to hold stuff in their hands. So we'll also make sure everybody who's registered for this webinar gets a link to sign up for that, to get it mailed to you as well. Wonderful. So we're going to jump into some questions. We've had some really good ones come in, and I will start with a question for Danny. So you talked about this a little bit, Danny. There were significant changes to the state surplus this year. Can you remind us how much remains in the surplus and the amount that could still be spent down by state leaders in the future?
Thank you, Erin. Yes, that is a great question. And there are really two big changes that we're talking about. The first is that the state went into this year's legislative session with about $15 billion in cash on hand. We spent about $6.2 billion of that. So that money is gone. That has been spent down on tax rebates, partly on funding, endowing the needs-based DREAM scholarship, partly on constructing a new psychiatric hospital, partly on infrastructure. So that $6.2 billion has been spent. So we can subtract that from the $15 billion that we started with. And then the state also made a change to the law governing the cap for what's called the Revenue Shortfall Reserve, or its rainy day fund, as it's often called. And so that went from 15% to 20%. So in effect, that's what we think of as kind of the savings account, where state leaders have tended to sort of brag about that being full. So that goes from about $5.6 billion to closer to $7.5 billion. So what will be remaining is $1 to $2 billion in undesignated surplus that can certainly be appropriated. And then the law is actually that the state can spend anything above 8% of prior year revenues. So the state could actually spend much of that $7.4 billion account, but practically they may want to hold on to a large chunk of that in the event of a recession.
So, this might be a like how this is set up question, but I just wanted to add on to that because I just saw a question that came in, Danny. How is there a surplus when the state is not meeting some of its funding requirements, such as the 75% mentioned in the education segment?
Yeah, right. That is a great question. And what it comes down to is there are many of these requirements that we can talk about or precedents that the state does not meet and has revised downward over the years. And ultimately, lawmakers have wide latitude to exercise their legislative discretion, essentially. And the governor also has wide latitude as well. And so in Georgia, our budget system breaks down against that sharing of powers, where the governor's primary power is to set the revenue estimate that caps what the legislature can appropriate. And so for Governor Kemp, it has been a pattern over the last 8 years to set a revenue estimate that is lower, sometimes by billions of dollars, than what the state has collected. And so that led to capping the amount that the General Assembly could appropriate, and in effect, the state having a very large amount of surplus money, one-time money that then the state chose to spend, but chose to spend in ways that were one time, on things like tax rebates or infrastructure spending in cash, or some of the other things that we named. So, in effect, because of the policy preferences of our state leaders, we were budgeting and appropriating in that manner. But that is not necessarily something that we have to do. And so we use these technical terms like surplus because that is the word for when you have money left over at the end of the year, after you've paid for all of the things that you funded in your budget. But in reality, as that the question asker named, there are many priorities that we are not funding and that we're not meeting, and that will certainly be a choice facing state leaders in the future, particularly whether it comes to whether to implement some of these regressive tax changes or tax changes looming over those General Assemblies that, again, the General Assembly passed without a plan to pay for. And so now we'll have to make that very direct decision of which policies do we want to prioritize and use our resources for.
Great. Thank you so much, Danny. So my next question is for Leah. And I see a question in the Q&A about pathways, so I'm going to kind of put two together. So we know that July 1st is the 3rd anniversary of Georgia's Pathways to Coverage program, which is our partial Medicaid expansion with a work requirement. And we know that July 4th is the first anniversary of the federal law known as H.R. 1, or the One Big Beautiful Bill Act, which mandates a similar Medicaid work requirement across all states. So, Leah, what would you say is next for Pathways and Georgia's investment in healthcare for low-income adults?
Thanks, Erin. That's a really great question. And yeah, great timing, because it was actually in July of 2023, for folks that aren't aware, that Georgia launched the Pathways to Coverage program, which, as Erin said, is a new Medicaid option for low-income adults, 19 to 64 years old, who aren't eligible for traditional Medicaid, but also don't earn enough to qualify for marketplace subsidies. So in order to qualify for Pathways, you have to report at least 80 hours per month of work, higher education, volunteering, or some other combination of qualifying activities. So in July of 2025, President Trump, actually July 4th of 2025, so coming up in a couple of days, it's the 1-year anniversary, President Trump signed into law H.R. 1, which we've already talked a little bit about, and made a Medicaid work requirement a nationwide mandate. It's structured similar to what we have here in Georgia, and it's going to be implemented on all states that offer coverage to low-income, non-pregnant, non-elderly adults. So sort of what's called the expansion population. So Georgia's experience with Pathways really offers a preview of what the 40 expansion states are likely to see come January 2027 when this policy begins to be implemented, though it's already started to be implemented in some states that really want that gold star. So what we've seen is more bureaucratic red tape for state agency workers and Medicaid enrollees. We've seen suppressed enrollment, even among people that do meet the work requirements, but have some sort of structural barrier, like they don't have high-speed internet to fill out the application, or they don't have a car to get to the DFACS office in their county. And we've seen really high costs, particularly high administrative costs, that are then borne by the taxpayers. So as of March of 2026, Georgia had invested over 30.9 million in state funds, but about 146.9 million in total state and federal funds in a program that has at that time had only enrolled about 16,000 Georgians were actively enrolled as of March of 2026. So that leaves about 180,000 Georgians still uninsured and stuck in that coverage gap. So again, come January of 2027, Georgia will actually also have to transition to this HR1 work requirement. And in some bizarre twist, because Pathways is actually more restrictive than the language in HR1, and we don't currently have any like long-term reporting exemptions, for example, Georgia might actually see some very small increases in coverage, while other states are going to see massive coverage losses. But either way, no matter how the work requirement is designed, whether it's Pathways or whether it's HR1, we know that work requirements are costly for taxpayers. They're really cumbersome for everyday Georgians to navigate, and they don't lead to long-term employment gains. So it's really critically important for us as Georgians who have the most experience with this failed policy to really continue reminding policymakers and even just our neighbors of the pitfalls of Medicaid work requirements, because when you just say that, it sounds good to a lot of people, but when you really show them how ineffective they are, how costly they are, it can really change people's minds. And so it's really important for when the healthcare policy winds change, we're sort of ready to pivot to a solution that's really better for Georgians and for our state's bottom line.
Thanks so much, Leah. So we're gonna jump over to talk about education quickly, and then Danny, I am coming back to you because we have a few questions about income tax cuts and things like that. So Ashley, can you talk a little bit first about the state of vouchers in Georgia?
Absolutely. You may have noticed that I didn't cover much of voucher information in my presentation, simply because there wasn't nearly as much movement as we saw, say, a couple years ago when the Georgia Promise Scholarship was passed. But this is a great question because it gives them an opportunity to kind of give a little bit of insight to some of the movement or some of what happened in this last session related to vouchers. So, as we know, Advocates for School Vouchers came off a huge victory in 2024. And it took about a year for the state to build out the Georgia Promise Scholarship. It's since rolled out in this past school year, was its first school year. And we are looking forward to that report. It should be hopefully coming out from the Georgia Student Finance Commission at the end of the summer. So stay tuned on some information as we get to analyze that data. Thankfully, no major movement in this last session. To expend vouchers. And I think that's somewhat of a win considering the push from the federal administration. Although there was a little bit of movement, the federal school choice tax credit, Georgia did opt in to this, and this is a result from the One Big Beautiful Bill, HR1. However, Senate Bill 446 and this particular bill would have codified the permanent participation in the federal tax program. and removes the language requiring an annual opt-in. But this bill did not pass, thankfully. And so that would have, again, codified our permanent participation in the federal school choice tax credit program. So, again, that bill not passing was a win. Again, here at GBPI, we do not support any vouchers of any kind. And lastly, I'll say to that question, Aaron, that SB 445 did not pass, and this would have expanded eligibility for the Georgia Promise Scholarship Voucher Program. And so there were certainly some proposals in this biennial. And some that did not, of course, meet that finish line. And so we've been protected in a few different ways from expansion, even given the federal school choice tax credit, which again has been opted into.
Thanks, Ashley. So I'm going to combine a few questions. One of the questions was, what do we think will be the impact of these income tax cuts? But then we had a longer question that asked, can we provide some layman terms around how the changes to taxes are going to negatively impact lower income earners and disproportionately benefit the highest earners for those who might not be in the weeds with us? Danny, what are some of the big messages you would want to get out to folks who might not be thinking about this every day, but might want to know the impact?
Yes, yes, we can. And that's something that certainly folks can look to GBPI to be producing in the weeks and months ahead, where we will have more information on kind of making this as digestible as possible. But the way that I would just describe this at the outset is that the General Assembly passed a 9-year, $6.3 billion huge income tax package with no plan to pay for it, and that is designed so that the top 1% and corporations get more than most Georgia households combined. So a hugely regressive tax bill where the majority of the benefits are steered towards those who are already earning 6 and 7 figures, or are large corporations, many of which are based outside of Georgia, are getting the largest share of benefits. And we don't have a plan to pay for it. And the magnitude of those tax cuts would be equivalent to essentially the amount that we spend on our entire Medicaid program, for example, to insure almost 2 million people. It's basically equivalent to our entire higher education system that is, our technical college and university system that educates about 500,000 people. So we're talking about a massive scale, and we've just seen a glimpse of it in year one. And as a result of that, the governor himself said basically the General Assembly didn't adequately account for the cost of these tax cuts, which in the first year is $1.2 billion. And because of that, he was making almost $350 million in budget cuts that cut funding for everything for Medicaid, to school buses and student transportation, to even funding for domestic violence and sexual assault centers, for the most vulnerable Georgians, even veterans homelessness. I mean, things that are just so egregious for a tax cut, again, where we compare just looking at the benefits that about 3 million households would get, a majority of Georgians, and the benefits that the 50,000 or so households in the top 1% and corporations would get, most of which for corporations goes out of state. And that is the larger bucket, both for the first year and if that were to be fully implemented over 8 years. So it is, that is just to lay out kind of the stakes of this legislation. But the positive side of it is that there are triggers that make it so almost certainly this wouldn't go into effect on its own. Kind of the backside of that, though, is that we've had those triggers in the past, and the General Assembly and the governor have passed legislation to override them. So we can't continue to do that, and we've reached a point where the gap between, to the surplus question earlier, the gap between the amount of money that the state was raising and spending, where that was kind of artificially large for a number of years because of the pattern that the governor set with the revenue estimate, that's